Listen, if you are over 50 and still pleasuring yourself, there is something absolutely critical about your prostate that nobody is telling you, and it might just save your life. I am Dr. Brandy, and what I am about to share with you today is information that will make you question why your own physician has been avoiding this conversation like it is some forbidden fruit. Stick around until the end. Comment the word active right now, and I will send you my completely free men's lifestyle guide specifically designed to prevent prostate cancer. Trust me, you will want that guide after what I am about to reveal. Now, let us talk about something most doctors whisper about in medical conferences but refuse to discuss in the examination room. The prostate protection nobody told you about. Gentlemen, I need you to sit down for this one. And if you are already sitting, sit harder. Harvard Medical School, not some random blog written by a guy named Chad in his mother's basement, but actual Harvard researchers tracked 32,000 men for 18 years. 18 years. That is longer than most marriages in Hollywood. And what they discovered will blow your mind more than finding out your wife actually does know where the television remote is. She just was not telling you. Men who ejaculated 21 or more times per month. That is right. I said it. Ejaculated, not self-expressed or released tension. Actual ejaculation showed a 20% lower risk of prostate cancer compared to men who only managed 4 to 7 times monthly. 20%, gentlemen. That is the same risk reduction some medications promise. Except this method is free, natural, and you do not need to ask your pharmacist for it while making awkward eye contact. But here is where it gets even more interesting. An Australian study, because apparently Australians are not just good at wrestling crocodiles and calling everyone mate, published findings in BJU International, that is British Journal of Urology for those keeping score at home, showing that men averaging between 4.6 to 7 ejaculations per week were 36% less likely to be diagnosed with prostate cancer before age 70. 36%. That is significant enough to make you reconsider your weekly schedule, is it not? Now, why does this work? I am glad you asked, imaginary person in my head. Your prostate produces fluid that mixes with sperm. When that fluid just sits there like your brother-in-law on your couch watching sports all weekend, it becomes a stagnant pool where inflammation, infection, and potentially cancerous changes can develop. Think of regular ejaculation as flushing out your plumbing system. You would not let your house pipes sit stagnant for months, would you? Although looking at some of your houses, maybe some of you would. Regular ejaculation reduces prostatic congestion, decreases inflammatory markers in the gland, maintains healthy cellular turnover, and basically keeps everything flowing like a well-maintained engine. Your prostate is not decorative, gentlemen. It has a job, and regular ejaculation helps it do that job properly. If this is the first time you are hearing this information, and you are wondering why your doctor never mentioned it during your last checkup, while they were elbow deep in places we will not discuss at dinner parties, hit that like button right now. And seriously, comment active because that free guide is packed with information your doctor definitely will not discuss unless you bring wine to your appointment. The frequency question and the massive mistakes you are making. Let us address the elephant in the room, or should I say, the elephant you are addressing in the room. How often should a man over 50 actually masturbate for optimal health? Most men have absolutely no reference point for this. You are either doing it and feeling guilty like you just ate the last cookie that was meant for guests, or you are not doing it enough and wondering why your prostate feels like an angry walnut. The research points to approximately 21 ejaculations per month as the sweet spot. That breaks down to roughly 5 times per week. Now, before you start planning this into your calendar between golf and arguing with customer service representatives, understand this includes everything: partnered sex, solo sessions, and yes, even those surprise nocturnal emissions that make you feel like a confused teenager again. It is the cumulative total that matters for prostate protection. Here is something fascinating that will make you feel better. Studies across Europe, where they are apparently much more comfortable discussing these matters than we are, found that between 41 and 65% of men aged 60 to 75 reported masturbating within the past month. You are not alone, gentlemen. You are actually in the majority. If you are doing it, you are normal. If you are not doing it, you are also normal, but you might be missing out on significant health benefits. Now, before you go thinking more is better and turning this into some kind of competitive sport, let me stop you right there. The protective benefits plateau around 21 times monthly. Going significantly beyond that does not give you extra credit or bonus points with your prostate. This is not a video game where more repetitions unlock a special health achievement. But here is where most men over 50 are making critical, and I mean absolutely critical, mistakes that are causing more harm than good. First, and I cannot stress this enough, inadequate lubrication. Gentlemen, your skin after 50 is not what it was at 20. It is thinner, less elastic, and more prone to damage. Dry friction is creating micro tears in delicate tissue, leading to scarring, irritation, and reduced sensitivity over time. Always, and I mean always, use a quality water-based or silicone-based lubricant. This is not optional. This is not a suggestion. This is a medical necessity. I do not care if you think you do not need it. You need it. Your future self will thank you. Second mistake, excessive grip pressure. Some men experience reduced sensitivity with age, which is completely normal, and they compensate by gripping harder. This creates a vicious cycle worse than trying to open a pickle jar with slippery hands. More pressure causes more tissue damage, which reduces sensitivity further, which leads to even more pressure. Stop it. Use a lighter touch. Focus on varied stimulation rather than trying to strangle the life out of your own anatomy. Third mistake, and this is important, excessive pornography consumption. Now, I am not your mother, and I am not here to lecture you about morality. But from a purely neurological standpoint, excessive pornography use alters your brain's dopamine response system. Some men find they cannot achieve arousal or orgasm without increasingly extreme content. This is a brain chemistry issue, not a character flaw. But it can absolutely interfere with real intimate relationships and your ability to function normally with an actual partner. Moderation, gentlemen. Fourth mistake, ignoring warning signs. Pain during or after masturbation, burning during urination, blood and semen, or difficulty ejaculating are not normal. These are not things you just power through like a head cold. These symptoms can indicate prostatitis, urinary tract issues, or other conditions requiring immediate medical evaluation. Do not ignore them. I know you are men and you think everything can be fixed with ice and walking it off, but this is not that situation. Fifth mistake, rushing through it like you are late for a meeting. After 50, your body responds differently. Your refractory period is longer. Everything takes a bit more time. Hurrying through the process can result in incomplete ejaculation, which does not provide the full prostate clearing benefits we just discussed. Take your time. Enjoy the process. You are not being timed. Comment below right now. Were you making any of these mistakes? Be honest. This is a judgment-free zone. Well, mostly judgment-free. I might judge you a little if you are still not using lubricant after I just explained it in detail. The mental health magic and erectile function insurance. Now let us talk about something most men do not realize. The benefits of regular ejaculation extend far beyond just your prostate. We are talking full body, mind and soul benefits that would make a wellness influencer jealous. When you ejaculate, your brain releases a cocktail of neurochemicals that would cost you hundreds of dollars if you tried to replicate it with supplements. Dopamine floods your system, providing pleasure and motivation. Oxytocin, often called the bonding hormone, promotes relaxation. Serotonin improves mood better than scrolling through social media and getting angry at strangers ever could. Endorphins act as natural pain relievers. And here is the kicker, prolactin, released during orgasm, has documented neuroprotective properties. It literally helps protect your brain tissue from stress-related damage. You are basically giving your brain a protective shield every time you finish. For men over 50 dealing with work pressure, retirement transitions, health concerns, or relationship changes, which let us be honest is basically all of you, masturbation provides natural stress reduction without medications, without side effects, and without having to talk to a therapist about your feelings. Although therapy is great too, no shade to therapy. Research also shows that sexual activity, including masturbation, correlates with significantly better sleep quality. The relaxation response following orgasm naturally prepares your body for sleep better than counting sheep or listening to boring podcasts ever could. I had a patient, let us call him Robert, who struggled with chronic anxiety and insomnia for years. He was absolutely reluctant to take prescription sleep medication because of potential side effects. We discussed incorporating masturbation into his bedtime routine as a natural alternative. Within 3 weeks, not 3 months, 3 weeks, he reported significantly improved sleep quality and reduced anxiety levels without a single pharmaceutical intervention. His wife also appreciated that he stopped tossing and turning all night like a rotisserie chicken. Now, let us discuss something that should matter to every single man watching this video: erectile function insurance. Yes, I just called it insurance because that is exactly what it is. Regular ejaculation actually helps maintain erectile function as you age. Think of it as exercise for your vascular system. Every time you achieve an erection, you are promoting blood flow to penile tissue, maintaining elasticity of blood vessels, preventing tissue atrophy, and keeping the erectile mechanism responsive and functional. Men who cease all sexual activity, whether by choice or circumstance, often experience progressive erectile dysfunction. Without regular blood flow, the tissue begins to deteriorate and lose function. It is truly, and I mean truly, a use it or lose it situation. Your body is efficient. If it thinks you are not using something anymore, it starts shutting it down like a business, closing unprofitable locations. I worked with a patient whose wife had serious health issues preventing intimacy for over a year. He completely stopped all sexual activity out of respect for her situation, which is incredibly thoughtful and loving. But when circumstances eventually changed and she recovered, he could not achieve adequate erections. We worked on gradually reintroducing masturbation to restore blood flow and function. After 4 months of consistent activity, his erectile capacity improved substantially, and their intimate relationship resumed successfully. Maintaining function requires regular use, gentlemen. This is not negotiable biology. So if you are in a situation where partnered sex is not available, whether due to health issues, relationship status, or just life circumstances, masturbation is not just acceptable, it is medically advisable for maintaining your erectile function. You are literally protecting your future intimate life. If that is not motivation, I do not know what is. The guilt trap, warning signs, and your action plan. Now we need to address something that affects millions of men, and it is completely unnecessary. Guilt and shame. Gentlemen, many of you were raised in religious, conservative, or simply repressed environments where masturbation was treated like some moral failing equivalent to robbing a bank or putting pineapple on pizza. Let me be absolutely clear about this from a medical standpoint. Masturbation is a normal, healthy, natural behavior with documented, peer-reviewed, scientifically validated health benefits, particularly for men over 50. There is zero, and I mean zero, scientific evidence of physical or mental harm when practiced reasonably and safely. None. If your religious or cultural beliefs create internal conflict about this, that is something worth exploring with a counselor or spiritual advisor who understands both faith and health. But the medical science is completely unambiguous. You are not doing anything wrong. You are maintaining your health. You are practicing preventive medicine. You are protecting your prostate. I had a patient tell me, and this broke my heart, Dr. Brandy, I spent 50 years feeling ashamed every time I masturbated. Learning the actual science freed me from decades of unnecessary guilt. I only wish someone had told me this 30 years ago. Do not be that person. Do not waste decades feeling guilty about something that is protecting your health. However, and this is important, there are situations where professional help is absolutely needed. If masturbation interferes with daily functioning, if you are doing it so frequently that it impacts work performance, relationships, or daily responsibilities, that indicates compulsive behavior requiring therapy. If you cannot stop despite genuinely wanting to, feeling completely out of control regarding sexual behavior is classified as compulsive sexual behavior disorder and requires specialized treatment. There is no shame in seeking help. If you experience persistent physical problems like ongoing pain, bleeding, severe skin irritation, or complete inability to ejaculate, all of these require urological evaluation immediately. And if masturbation is completely replacing partnered intimacy, if you are consistently avoiding sex with your partner because masturbation is easier or more satisfying, that is a relationship issue worth addressing with a couples therapist. These situations apply to a very small minority of men, but if any of this resonates with you, seeking appropriate help is important and nothing to be embarrassed about. Let me give you a comprehensive action plan for healthy practices after 50. Regarding frequency, aim for approximately 20 to 21 ejaculations monthly, roughly 5 times weekly. This includes both partnered sex and solo activity. The total count is what provides prostate protection. Regarding technique, always use adequate lubrication, water-based or silicone-based products. Protect your tissue. No exceptions. Regarding pace, allow adequate time. Do not rush. Complete, unhurried ejaculation provides maximum health benefits. Regarding balance, if you are in a relationship, maintain variety between partnered sex and masturbation. Both have distinct benefits for intimacy and health. Regarding pornography, if you choose to use it, do so mindfully and occasionally rather than habitually. Be aware of potential dependency developing. Regarding your body, listen to physical feedback. Any pain, discomfort, or functional changes should prompt immediate medical consultation. Regarding psychology, release the guilt and shame. You are engaged in scientifically validated health maintenance. Gentlemen, let me bring this all together for you. Masturbation after 50 is not something to feel embarrassed about, confused by, or ashamed of. It is a normal, healthy behavior with substantial, scientifically documented health benefits. The research is clear and compelling. Regular ejaculation, approximately 20 to 21 times monthly, significantly reduces prostate cancer risk, supports erectile function, provides mental health benefits, reduces stress, and keeps your sexual system functioning properly. Your age makes this more important, not less. Prostate health becomes increasingly critical after 50, and you have a simple, natural, free tool to protect it. Stop letting outdated shame, misinformation, or embarrassment guide your decisions. Start letting science and evidence guide you instead. If you found this information valuable, hit that like button right now. Comment active below, and I will send you my completely free men's lifestyle guide specifically designed to prevent prostate cancer. This guide is packed with information your doctor will never discuss unless you specifically ask, and even then, they will probably get uncomfortable. Subscribe for more evidence-based health guidance on topics